I'm a neurologist. I'm also an epileptologist is my subspecialty, so I'm a seizure specialist. I also have a lot of work that we're doing in dementia and Alzheimer's, and I see a lot of head injuries, concussions, and post-traumatic head injury syndromes. Neurology, for the most part, is not a very happy subspecialty. But when you have people who are suffering, or let's take like our seizure patients, they walk around with a lot of stigma and a lot of still old wives' tales and stuff. And when you can take an individual and you can make it to where maybe you can't get rid of their disorder, but when you can have them have a normal life other than taking their medicines or potentially having their surgeries or things like that, when you can actually impact the quality of life of someone as well as participate with them, for me, that's very rewarding. And I think it's also something that I try to give back. One of the things you need to know is not every hospital or even major hospital system has an epilepsy monitoring unit. I've been very blessed at THR in that I came to them, they were very interested in that. They realized that 1% or more of the population will have a seizure disorder. And so they look at it as not only a service to the community, but a very special niche population with a great need. One thing I will tell you, obviously, we've been doing this for a while. We're not exactly young. So we've had several of these monitoring units, and I'll tell you truthfully about THR. When you come into the monitoring unit, of course it's not home, but you have your own private room. You have your own private bathroom. In fact, I tell my patients the worst of it is you're gonna have to see me every day, but our staff is excellent. The nurses are very caring. We have great EEG technicians. You have your own dietitian, and so we try to accommodate people. If they need for family to stay or someone to stay with them, there's like a little chair that'll let out into like a twin bed. But we try to make it as best we can, very accommodating to them. The techs and the nurses have been specifically trained. They're excellent. There's many times, of course, they make my job just wonderful because they just do a rundown. This one, this, and this, and pretty much it's like, what am I supposed to do besides agree, right? So it's a wonderful hospital. We're very, very, very well. The administration supports us very well. It's the top of the standard of care. So I'm very blessed to be associated with that.